Hello, my name is Dr. Michael Goddard with the California Foot and Ankle Institute in Irvine, California. Thank you for coming to our site to learn more about conditions that may affect you or loved ones. I'd like to talk to you about peripheral neuropathy. That's a condition where there's disease or damage to nerves, which affects sensation, movement, organ or gland function. Oftentimes patients have symptoms where there's numbness, burning, tingling, pins and needles. They may have weakness, imbalance. I've actually had people say that they had poor bladder control. These are very unusual symptoms, and a lot of people don't know what's going on with them. And they're looking for answers. What are the causes? Well, there's a long list. But on the very top of this list is diabetes. And what we've seen with a lot of patients is that once you find this underlying cause, there's a way to manage their problem systemically, and we can help gear that to treatment. One of the things that we've noticed over the years is that a lot of clinics out there try different treatments, and a lot of these clinics aren't really finding out what the root cause is, so they have no idea what they're going after and what they're trying to accomplish. Yes, maybe the patients may feel better short term, but what's the long-term implications? So it's very important to make a diagnosis. We take a lot of time to make a very detailed diagnosis. We will spend a lot of time in the history and physical examination, and especially the neurological examination. We will send patients out for nerve conduction studies or EMGs. We will have patients go out for MRI studies. We'll oftentimes get blood work so we can look at different vitamin panels or hormone levels. Sometimes it's genetic tests that are needed. I've had patients where I've had to go the extent of doing a biopsy to check the little nerve fibers in their skin. And in rare cases, I need to take local anesthetic and I need to find out, why is a particular nerve hurting so bad in that leg or that foot? And that's called a diagnostic nerve block. All these things are necessary tools to find out what's going on so that we can create a suitable treatment for these patients. When we talk about treatments, I've had a vast number of patients come to me and say, hey, I'm taking these medications and I don't really know what they're doing. You know, this one's an anticonvulsant or this one's an antidepressant. Well, that's pretty commonplace in our current or modern medicine. And unfortunately, when it comes to treatment for peripheral neuropathy, we don't like a Band-Aid approach. We have a lot of patients that are taking a whole bunch of medications that they don't even know what they are or what they're doing. And that's a big problem. We try to stick to very strict guidelines that are well accepted across the medical community nationally and internationally, FDA-approved modalities to treat peripheral neuropathy. We do a lot of stuff here in our office. Some of these treatment regimens may go from 6 weeks to 6 months or even longer. We like to use nutraceuticals or medical food as prescriptions. And this is a wonderful way to get great supplements into the body for patients that are otherwise lacking it or need the supplementation to heal these nerve problems. At the end of the day, here at California Foot and Ankle Institute, we're trying to see these patients better. That's our job, that's the oath we took, and we take pride in doing it. And we're good at it. Thank you very much for listening.